how do we live with that. Okay, because once we get it, it's not that life is not possible. Definitely life will have proper outcomes if we follow the measures advised by the consultants or the doctors. So it becomes very easy just to follow few steps and then to breathe easy, because we know that in asthma there are multiple symptoms. As you all know, few symptoms I may just tell that we all know asthma are areas of expertise from both of them, and they will individually tell us how we can diagnose asthma and what is the future of asthma. Before handing over, would like to tell what is the theme of asthma this year. So every year asthma has a World Asthma Day has a theme. So this year's theme is specifically named as Asthma Education Empowers. That's the name of 2025 theme, Asthma Education Empowers. She has special interest in asthma, COPD, which is respiratory illness, and sleep medicines or sleep studies, then ILD and COPD. These are the few areas of interest. I would like to hand over the mic to Dr. Smita. Welcome, ma'am.
Good morning.
Thank you for joining us. From the Department of Pulmonary Medicine, Sparsh Hospital, Yelahanka. From the Department of Pulmonary Medicine from Sparsh Hospital, Yelahanka, we welcome all of you to celebrate, rather observe this World Asthma Day. So as Dr. Jyoti has already introduced, I just want to let you all know why do we celebrate this World Asthma Day. This is celebrated on every Tuesday, on the first Tuesday in the month of May. This is basically to create an awareness amongst people, individuals who are, suffering from asthma but not able to get access to the treatment or diagnosis. That's one thing. The other thing is we observe this day because people who are suffering from asthma need access to care. So in tertiary care, yes, it's available, but when you reach to the peripheries in the rural area, it's still a difficult task to reach and to diagnose asthma itself. But the term asthma, why do we have a stigma with it? Why do we have a fear with it? One, because most of us think that asthma is somehow an end-stage disease. So when you say asthma, they are very happy with bronchitis or some other diagnosis. But when I say asthma, most of them feel it's an end stage where there is no cure. But that's wrong. Asthma is nothing but your allergy in your lungs. Simple. So allergy that happens on the skin that causes redness. Similarly, the allergy that happens inside your lungs causes to make you wheeze. So that is asthma. And the other symptoms can be just cough or just breathlessness that goes unnoticed. And coming to the diagnosis, we usually diagnose basically the clinical scenario, the clinical symptoms, as well as something called as a lung spirometry, the pulmonary function test. So after diagnosing, the mainstay of treatment lies the inhalers. There's no doubt about it. Because whatever medicines we give, oral medications go to your stomach. They don't reach your lungs directly. Like I always tell my patient, if you have a wound, you tend to apply something on the skin. So similarly, if you have a wound in your lungs, it has to reach your lungs. And again comes the stigma with inhalers. So nobody likes it.
For normal individual, so this is the area of normal individual without asthma, without any allergies or without any infections. So this is the lumen where the air enters the lung. So this is how the respiration occurs. It enters through this air pipe, main air pipe. It will go into the lung, which will branch out like a tree. Marattara irutte ella branch out. So what happens in asthma? Asthma ali enagutte? So allergy anta madam helidru. So allergy enagutte? There will be swelling of the airways. Ade kaiಗೆ ಏನಾದರೂ ಏಟ್ ಬಿದ್ರೆ ಊತ ಬರುತ್ತಲ್ಲ, swelling ಬರುತ್ತೆ. Similarly, there will be swelling. So you can see it here. There is swelling of the airways. Compared to this, the airway has become narrower. So swelling in ಏನಾಗುತ್ತೆ? There will be accumulation of fluid. Any swelling in the body, any injury in the body, that will tend to accumulate fluid. So that is accumulated here. So it will further narrow down the airway. That is when you get this wheezing, breathlessness, difficulty in breathing, lot of cough and sputum production will happen. So if you leave it for a longer time, this will go for a permanent remodeling. So ಯಾವಾಗಲೂ ಸ್ಕಾರಿಂಗ್ ಅಂತ ಹೇಳ್ತೀವಿ, ಏನು ಕರೆ ಆಗುತ್ತಲ್ಲ ಏನಾದರೂ ಗಾಯ ಆದರೆ, ಸೊ ಆ ಥರ ಇಟ್ ವಿಲ್ ಗೋ ಫಾರ್ ಸ್ಕಾರಿಂಗ್ ಆದಮೇಲೆ ಇಟ್ ಇಸ್ ಅ ಇರ್ರಿವರ್ಸಿಬಲ್ ಪ್ರೊಸೆಸ್. Whether we treat it or not, you take whatever medication at that time, it won't work much. So it is very important for us to give medication before that occurs. That is one point. And few other important things, any questions in between you can definitely ask me. So few other important things we might have to address in asthma is there are few techniques which we have to follow and few procedures like vaccination and all we'll have to give just to prevent the infection. So if you are asthmatic, you will be more prone for getting infection like a COVID or like a influenza or H1N1. Any infection, you will be more prone because there is.
I hope you're all interested. Yes? Yes? No?
Yes, yes.
Okay. So let's start off with a small warm-up. So before that, let me just understand that you all know the symptoms. You've heard to both our efficient doctors telling about the symptoms. So can we have the symptoms one by one? Anything that you know?
Breathlessness.
Correct. Wheezing. Breathlessness, wheezing.
Cough.
Difficulty in breathing. Correct. Anything else?
Cough.
Running nose. Cough.
Sneezing.
Sneezing. It affects your activities of daily living. Cough and everything. But what does it do?
Slow down.
It will slow down your quality, it will slow down your activities of daily living. You might cook in 1 hour, but because of this, you're not able to stand for a continuous hour, so it goes up to 3 hours. You were going for a walk, which you really love to do because you will meet your friends there. Alva? Friends ella siktare, so aramagi ellar hatra matadi. That is a way of you relaxing, getting your stress out of the day. So all that comes into a boundary because you feel ಆಚೆ ಹೋದಾಗ ಏನಾದರೂ ಆದರೆ ಸಡನ್ ಅಸ್ತಮ ಅಟ್ಯಾಕ್ ಆದರೆ ಏನು ಮಾಡೋದು ಅಂತ. So we'll help you out to improve your quality of life for sure, but I want all of your participation for sure. You are the main identities to show them alva. Okay, we'll start with a small warm-up since there is restriction, so you can all do a spot marching. Let's do. Any difficulties, you can stop. Don't worry. You can stop, take a break, and then continue. You don't have to push through. Okay? Start right now? Okay. Let's start spot matching. Okay. Always move your legs up, right? Yes. Very nice. Oh, active. Sir goes for jogging every day.
Ex-serviceman.
Very nice. You should feel the warm-up. Your body should not go. Right? You should stay stable. Only your foot. See, this is not what we want. Your body is stable. Your foot is stable. Do you all know that there is a muscle which is called a second lung?
Yes.
Lungs ಇದೆ ಅಲ್ವಾ ನಮಗೆ? 2 lungs ಇದೆ. One muscle ಇದೆ. ಅದನ್ನ ನಾವು second lung ಅಂತ ಕರಿತೀವಿ.
Calf.
Any idea?
Calf muscle.
No, that's a second heart. Second lung. Quadriceps. Thigh muscles. That's your thigh. Quadriceps muscle. If you see many people who have this, we breathe in through our nose. While we are breathing out, we breathe out through our mouth. But in a technique, not that, in a technique, you're not breathing out from your mouth. The complete air should come out from your lungs. Okay, so ಅದಕ್ಕೆ purse slipped ಅಂತ ಈ ಥರ ಹೀಗೆ ಮಾಡೋದು. Okay, your lips come out. Okay, but your breath ಬಾಯಿನ ಫುಲ್ ಊದಿಸ್ಕೋಬಾರ್ದು. Okay, it should be very simple. We'll demonstrate and you all can follow. We'll do 5 repetition of each exercise so that you remember. ನೆನಪಿರುತ್ತೆ, ಮನೆಗೆ ಹೋಗಿ ಮತ್ತೆ ಪ್ರಾಕ್ಟೀಸ್ ಮಾಡ್ಬೋದು. And also one more thing, it is not that only if you have asthma ಇದನ್ನು ಮಾಡಬೇಕು ಅಂತ. Very important. Astama ಯಾವಾಗ ಬೇಕಾದರೂ ಬರ್ಬೋದು, ಬರ್ದೇ ಇರ್ಬೋದು, ಬಟ್ ಲಂಗ್ಸ್ ಕೆಪಾಸಿಟಿ ಇಂಪ್ರೂವ್ ಮಾಡೋಕ್ಕೆ ಆಲ್ ದೀಸ್ ಎಕ್ಸಸೈಸಸ್ ಆರ್ ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್. ಬ್ರೀತ್ ಔಟ್ ಥ್ರೂ ಯೋರ್ ಮೌತ್. ಬಾಯಿ ಊದಿಸ್ಕೊಳ್ದೇನೆ ಹೊರಗೆ ಹಾಕಬೇಕು ಗಾಳಿಗ. ಇಟ್ ಶುಡ್ ಕಮ್ ಫ್ರಮ್ ಯೋರ್ ಲೋವರ್ ಲಂಗ್ಸ್. ಬ್ರೀತ್ ಇನ್ ಥ್ರೂ ಯೋರ್ ನೋಸ್, ಬ್ರೀತ್ ಔಟ್.
ಯು ಶುಡ್ ಫೀಲ್ ಎಲ್ಲ ಗಾಳಿ ಖಾಲಿ ಆಗಿದೆ ಎಲ್ಲ. ಓಕೆ, ಸೊ ಈಗ ವೆನ್ ಯು ಆರ್ ಡೂಯಿಂಗ್ ಬ್ರೀದ್ ಇನ್ ಆ್ಯಂಡ್ ಬ್ರೀದ್ ಔಟ್, ವೆನ್ ಯು ಆರ್ ಬ್ರೀದಿಂಗ್ ಇನ್ ಯೋರ್ ಚೆಸ್ಟ್ ಶುಡ್ ನಾಟ್ ಕಮ್ ಅಪ್, ಇಟ್ ಶುಡ್ ನಾಟ್, ಓನ್ಲಿ ಯೋರ್ ಅಬ್ಡಾಮನ್ ಶುಡ್ ಕಮ್ ಔಟ್. ಸೊ ಯು ಆರ್ ಬ್ರೀದಿಂಗ್ ಥ್ರೂ ದ ಡಯಾಫ್ರಮ್ ಅಂತ. ನಿಮ್ಮ ಚೆಸ್ಟಿಂದ ಅಂದರೆ ಇಟ್ ಇಸ್ ಜಸ್ಟ್ ಯುವರ್ ಅಪ್ಪರ್ ರೆಸ್ಪಿರೇಟರಿ ಮಸಲ್ಸ್ ಆರ್ ವರ್ಕಿಂಗ್ ಅಂತ, ಡಯಾಫ್ರಾಮಿಗೆ ಕೆಲಸ ಕೊಡ್ತಿಲ್ಲ ನೀವು ಅಂತ. ಓಕೆ, ಸೊ ಬ್ರೀದ್ ಇನ್, ಚೆಸ್ಟ್ ಹೀಗೆ ಬರಬಾರ್ದು, ಚೆಸ್ಟ್ ಶುಡ್ ನಾಟ್ ಕಮ್ ಅಪ್, ಯುವರ್ ಅಬ್ಡಾಮನ್ ಶುಡ್ ಬಿ ಫಿಲ್ಡ್ ವಿತ್ ಏರ್. ಅಗೇನ್ ಯು ಫಾಲೋ ಅಗೇನ್ ಪರ್ಸ್ ಲಿಪ್ ಬ್ರೀತಿಂಗ್. ಫಸ್ಟ್ ಒನ್ ಏನು ಮಾಡಿದ್ವಲ್ಲ ಅದನ್ನೇ ಫಾಲೋ ಮಾಡ್ತೀರಾ ಬ್ರೀತ್ ಔಟ್ ಮಾಡಬೇಕಾದ್ರೆ ಕೈ ಹೊರಗೆ. ಅಗೇನ್ ಯು ವಿಲ್ ಬ್ರೀತ್ ಔಟ್ ಥ್ರೂ ಯುವರ್ ಮೌತ್. And while you're coming up, breathe in very nicely and go behind. Very good. Breathe in. Mail करಬೇಕಾದ್ರೆ ಉಸಿರು ಹೊರಗೆ, because expand ಆಗ್ತಿದೆ ಅಲ್ವಾ ನಮ್ಮ ಆರ್ಮ್ ಮಸಲ್ಸ್ ಆಗ್ಬೋದು. ಪೋಸ್ಚರ್ನ ಇಂಪ್ರೂವ್ ಮಾಡುತ್ತೆ ಬೇಸಿಕ್ಲಿ. ಓಕೆ, ಸೊ ದೇರ್ ಇಸ್ ಸಮಥಿಂಗ್ ಕಾಲ್ಡ್ ಥೆರಾಬ್ಯಾಂಡ್ ಆ್ಯಂಡ್ ವೇಟ್ ಕಫ್ಸ್ ದಟ್ ವಿ ಯೂಸ್ ಫಾರ್ ದ ನೆಕ್ಸ್ಟ್ ಲೆವೆಲ್ ಆಫ್ ಎಕ್ಸಸೈಸಸ್. ಓಕೆ, ದಿಸ್ ಇಸ್ ಥೆರಾಬ್ಯಾಂಡ್. It is a resistance band. You get it in different colors. So idella hinge andre you can implement this, you can learn from us and you can continue on your everyday basis at home. Okay, you can come just weekly once atara bandu, you can learn new exercises and you can do it on your daily basis. Hege ನೀವು walking ಹೋಗ್ತೀರಾ every day, the same way in that particular time you can also implement these exercises. Okay, so and also ಎಷ್ಟು ಜನ physically active ಇದ್ದೀರಾ? Walking, swimming, jogging. Sartha is completely active. Very nice. So minimum of half an hour to 40 minutes of physical activity is advised in your daily life. Anything, cycling, swimming, walking, jogging, anything. But ಈಗ ಎಷ್ಟೊಂದು ಜನ ಹೇಳ್ತಾರೆ my work includes walking ಅಂತ. That is not your physical activity. Because ನಾವು work ಮಾಡಬೇಕಾದ್ರೆ, so in case I am working in the hospital, I am moving around, but I meet ma'am in center, she'll stop me, she'll ask me. I am not in the same pace. Walking physical activity is same pace na yavag follow ಮಾಡ್ತೀರಾ ನೀವು. The same speed, the same movement, continuous movement. When you're walking, you stop in each different variations, you talk to somebody, that pace is gone. Alva? So that's why 30 to 40 minutes of continuous physical activity is advised. Anything you can start off with. You don't have to start off ivatte half an hour or 40 minutes. You can start with 15 minutes, 20 minutes, take a break, again continue. Okay? Any doubts? Anything? Questions you can always ask. No doubts with exercise.